We've talked about atrial fibrillation on Smart Medicine before. The condition, also known as A-fib, affects the rhythm of the heart. The irregular heartbeat caused by A-fib can lead to stroke or other heart-related complications. As Doug Johnson explains, there are steps you can take in the heart of the matter to reduce your risk.
For most people, the heart is one of the most consistent things in their lives. Its regular beats send blood throughout the body. But for an estimated 2.7 million people, an irregular heartbeat is a problem called A-fib, or atrial fibrillation.
Atrial fibrillation is an electrical disorder of the heart in which the top chambers of the heart, or the atrium, beat in a chaotic or irregular manner. It is the most common rhythm disorder in the United States, affecting millions of Americans, and increases patients' risks of heart failure and in particular stroke.
A regular heartbeat moves blood into the ventricles in an effective manner. The quiver or flutter of A-fib throws off the steady flow of blood through the body. When blood slows down or pools in the upper chambers of the heart, there's an increased risk of blood clots, which can lead to stroke.
So there's no specific cause for atrial fibrillation, but there are multiple risk factors. Things like high blood pressure, diabetes, coronary artery disease, heart failure, valvular heart disease, and in many cases, sleep apnea, which is often undiagnosed.
People who have uncontrolled hypertension over long periods of time are at risk of AFib, so it's important to watch your diet and stay active. Supraventricular tachycardia, or rapid heart rate, may trigger the problem in athletes. Binge drinking can also increase the risk of atrial fibrillation.
Patients' symptoms can be as simple or as nonspecific as some fatigue and tiredness, but they can experience chest pain, fainting episodes or syncope, as well as swelling in the leg, and occasionally stroke and heart failure.
While some people may notice a flutter or thump in their chest, many people with AFib may think their symptoms are other, less serious problems or not a problem at all.
Some people do have symptoms, but approximately 50% of patients are unaware of their atrial fibrillation.
Doctors can often diagnose the condition during an office visit using an electrocardiogram or by sending people home with a portable monitor, which tracks their heartbeats over a 24-hour period.
Medical therapy is first line for treatment of atrial fibrillation. Specialized medicines called antiarrhythmics can help minimize the risk of recurrence or suppress the rhythm.
If medications don't work, specialized cardiologists can perform a procedure called A-fib ablation, which places a catheter inside the heart and then either using a freezing or burning technique to remove the triggers for atrial fibrillation. But even with treatment, or if the condition seems to go away on its own, follow-up is necessary.
I would classify atrial fibrillation like coronary disease. It's a chronic medical condition that requires periodic visits to your physician to make sure that you're using the right tools, whether it's medicine or whether it's ablation or blood thinners, to make sure the problem remains controllable and managed.
For Smart Medicine, I'm Doug Johnson.